Welcome to this session about the evaluation framework for Darling Downs South West Queensland Medicare Local. The aim of this evaluation framework is to enable better planning and decision making, and the aim is also that there will be a standard approach to evaluation across the whole of the organisation. As famous economist Milton Friedman once said, one of the great mistakes is to judge policies and programs by their intentions rather than their results. It's very easy when we start looking at projects to think we're going to make this difference. But the most important thing is to work out, did we actually do that? And in order to do that, we need a really good plan of how we're going to make the best impact for patients or other health professionals. It's about writing down ahead of time how we're actually going to know we've been successful. So that's where the evaluation framework comes into place. It's about supporting robust evaluation, working out did the project actually deliver on what it said it was going to. And in order to do that, it will also mean we have effective prioritisation and decision making. We have limited amounts of funds, so if we keep funding projects that don't make a difference, there won't be enough money left for projects that have proven to make a difference. So the main objectives of project program evaluation are to inform decisions. This means that we can work out what in the future should be funded and what programs should continue, what interventions make the difference and which ones should perhaps cease. To demonstrate accountability to decision makers. One of our key stakeholders is the Department of Health. When they give us money, they would like to know whether we're making a difference and using those resources in the best possible way. That's what project evaluation can do and deliver on. Enable learning and contribute to the body of knowledge. If we have a successful project, we'll be able to share it with others and show them that we have evaluated and worked out why it's been successful and things that they could do to replicate it. Verify and or improve program quality and management. If we have a project and we evaluate it, continuously improving on it will enable in the future better programs and better outcomes. A key one is to identify successful strategies for extension, expansion and replication. It's very hard to extend or expand on a project if you don't actually know if it's making a difference. Another benefit is to modify unsuccessful strategies, working out why they've been unsuccessful. Is it due to poor project planning? Is it that it just didn't work? And measure the effects and benefits of a project or program and interventions is a key one. And giving stakeholders the opportunity to have their say. So in an evaluation, it might mean to survey patients who were involved, have their say, get their opportunity to say what they thought worked and what didn't. So the evaluation framework is based on a traffic light system from dark green to black, where dark green is excellent through to black, very poor. The aim of using the traffic light system is that it means all projects can be compared against each other and we're comparing apples with apples. Each criteria has a thorough analysis and commentary, and if depending on the level of evaluation, it's summarised in a table of findings so that all of the evaluation criteria can be easily seen on one page. As discussed earlier, it's really important to ensure we know whether plans have been successful. And as Dwight Eisenhower, ex-president of the United States, once said, plans are nothing, planning is everything. So this is the evaluation method matrix. This is what we use to determine what type of evaluation we will do for the project. So there are 4 types of evaluation methods. A high risk, politically significant or risky project would require an external evaluation. However, a high cost project that was low risk could be done internally but through a detailed evaluation. A detailed evaluation is also used for projects that may cost very little but are of high risk or political significance. For projects that are low risk and low cost, summary evaluation methods are suitable. And finally, while all projects need a benefits realisation plan, this is the only thing needed for projects that are low risk and low cost. The 4 different types of evaluations will now be discussed. So an external evaluation would be used for a high cost, high risk project. An external evaluation is just that. It's done by an external company or university. For example, the University of Southern Queensland or Griffith University. This form of evaluation is very robust, it's very in-depth and would take a lot of money and time. The next form of evaluation is the detailed evaluation, and this is used for a lot of projects that are either high cost and medium risk to low risk, or high risk and low cost. This form of evaluation is done internally, but it is a bit like the external evaluation in that it involves a lot of detail and a thorough analysis. The evaluation framework for a detailed internal evaluation comprises 9 evaluation criteria: evidence to support the project or program, strategic alignment, an equity summary of how we're reducing health inequalities, and measurement, evaluation and reporting requirements from our benefits realisation plan. These are broken into outcome key performance indicators or KPIs, action KPIs, and timeframe KPIs. We also look at the financial impact. Is it cost effective and is it affordable? And finally, we look at unexpected spin-offs. Was there anything that wasn't planned that the project actually ended up doing inadvertently that wasn't expected? So let's look at these one at a time. The evidence to support a project or program will require an in-depth, up-to-date literature review. This is then compared to whether the project met its objectives. So if a project met all of its objectives or a lot of them, and there was a lot of evidence to support, it would get a dark green. However, if the project did not meet its objectives and did not have any evidence based in the literature, it would receive a black. This is a really good way of working out whether this is something that was just thought of or whether there really is groundbreaking evidence to support it or evidence that's been done internationally or nationally. Strategic alignment. This assesses how the project is aligned to both federal and state objectives, Medicare local plans and other documentation. So this includes things such as the annual and strategic plans and our comprehensive needs assessment. If the project or program is a priority for Medicare local and Queensland Health and the federal government, it would get a green light. If the project was only mentioned in a Medicare local plan, but there's no mention of it in either a Queensland Health or federal government plan, then it would be a red. And if there is no mention of the project in any documentation, it would receive a black. Equity summary is about reducing health inequalities. So if it's identified that the service was going to make a difference for Aboriginal and Torres Strait communities, we need to look at, were there positive impacts possible and realised, or was there no impact on health inequalities? If there's no impact, there would be a red beside this indicator, and if there are positive impacts possible and realised, there would be a level of green. The outcome, action and timeframe KPIs come from your project or program benefits realisation plan. So every program or project will have this benefits realisation plan, which details what you're going to do, how you're going to do it, and what time frame you're going to do it in. For example, the outcome measures might be that you're going to reduce ED presentations as a result of your project. This measure would show whether you actually were able to achieve this or whether there were no positive outcomes as a result of your project. The action evaluation measures are what actions you said you were going to take to achieve your project. For example, if you said that by 30th of June you were going to employ 5 nurses to undertake the project, but you only achieved 1 nurse, you would then look at the scale and look at 20% achievement, which would be black, no actions achieved, or less than 24%. Timeframes are based on the timeframe you stated. For example, if you said that the project was going to be implemented in phase 1 by 30th of June, where did it fit? Did you actually achieve it in the timeframes you said? The financial impact section can be broken down into 2 main areas: cost effectiveness and affordability. The cost effectiveness section looks at comparing the service to others and seeing whether it addresses the same need at a higher or lower cost. So does it provide good value for money? A cost-benefit analysis would be used. Affordability is concerned whether the project remained within budget. So if the project went over budget, it would mean that money would have to be taken from other projects to help fund the deficit. The financial impact cost effectiveness evaluation criteria looks at whether the service or project is unique and no other initiatives address the same need, provides a better service than other initiatives addressing the same need, provides a service that is comparable to other initiatives addressing the same need, provides a service that is more costly than other initiatives addressing the same need, or provides a service that is more costly and less effective than other initiatives addressing the same need. We then look at whether the benefits or expected benefits were actually realised. If all the benefits were realised, and this is a unique project or service addressing the needs and there are no others doing it, a dark green rating would be given. If the project is found to deliver a better service than others addressing the same need and all the benefits were realised, it would be given a light green. But if the project had all its benefits realised, but it was more costly and less effective than others, it would receive an orange. If no benefits were realised and it was more effective, it would receive a black. Or if the service is unique and no other services addressing the same need and no benefits were realised, it would receive a yellow. The financial impact affordability criteria looks at how it remained within its budget over the life of the project. For example, if all costs were contained well within budget, it would receive a dark green rating. If the costs were over budget, it would receive a light green if it was between 0 and 5% deviation. And if costs were significantly over budget, that is greater than 35% deviation, there would be a black rating given. So the last evaluation criteria is unexpected spin-offs. So this is looking at things that were really beneficial but weren't identified in the benefits realisation plan. This may be because we weren't expecting this to happen. This is things that were very positive. For example, if you thought that there was going to be a reduction in child asthma rates because of introducing a respiratory program, but it also reduced ED presentations, then you would say there's a strong link, and a major spin-off, you'd give it a dark green. However, if there was no real clear link between the project and the ED admissions, and it happened that maybe it could have been related to something else, or there was a weak link, you'd give it a yellow or a red. For most projects, you won't be expecting any kind of benefit, and nothing may happen that you weren't expecting, so you can use a grey, which is a not applicable. So the summary evaluation is used for projects that are medium cost but low risk, low or negligible risk, or medium risk, low cost. Much simpler form. It's just simply a summary of high-level information. This is an example where it may have just a sentence or two describing what actually happened. Because for this evaluation method, we're looking at funding for a project between $20,000 and $75,000. Other examples here of summary tables are provided where you can see at a glance the rating for each of the projects on one page. This summary table would become part of the executive summary for a more detailed evaluation. But for a summary evaluation, this is the evaluation form. The final type of evaluation that can be done is the benefits realisation plan. This is required for all projects, but for low cost, low risk projects, this is the only form of evaluation that's required. And this is reporting against the items in your benefits realisation plan. So for the benefits realisation plan evaluation, no matter what the scale and scope of the project, you will need to do this. It can simply be a high-level summary of your key performance indicators, your target, how you're going to measure it, who's responsible, and your reporting timeframes. For example, this shows the KPI table for the collaborative clinical pathways. It says that a timeframe KPI will be 10 pathways developed and published on Map of Medicine by 30th of June 2015. It will be based on looking at the collaborative clinical pathway documentation that's reported monthly. There's also number of ED presentations by pathway condition. We want to see a reduction. That would be based on ED data from the Hospital and Health Service, and it would be collected biannually. So once we have our benefits realisation plan, that becomes a living document. So we would add a column to show the results and how we're going meeting what we said we were going to do. And this is where for the less costly projects, it's adding the column and putting the scale of red, green or orange in there. This concludes our session on the evaluation framework. If you have any questions or concerns, you can give me a call or email me. I'm happy to discuss this with you. If you'd like some help developing your benefits realisation plan and you're not sure where to begin, you can also contact me or Tiana or Jodie Edge in the planning department. Thank you.